Hello everyone, I am Dr. Simona Bartos at Imperial Dermatology, and today I will take you on my journey with the best treatment that I've had done recently, which is Morpheus 8, one of the better platforms we have for non-surgical facelift. And I know you have a lot of questions. Does it help with the skin quality? Does it get to the fat? Does it work well together with fillers and toxins? What are the possible side effects? Stay tuned and let's answer all those questions for you. Morpheus is radio frequency coupled with microneedling. And many of you are already familiar with microneedling, where we have many needles going in and injuring the tissue. And in the process of healing, there's new collagen production and growth. Like microneedling, here we have multiple needles going in, penetrating the tissues and causing that controlled injury, which leads to healing, collagen production, and elastin production. But with Morpheus, we also deliver radio frequency, which is truly the holy grail of energy devices. So we couple microneedling with radio frequency for best possible results. The first step is to apply the numbing medicine on. Some patients may require nerve blocks, where we inject lidocaine under the eyes, above the eyes, and in the chin area, again to block the nerve and give you a more generalized anesthesia. And many physicians use nitrous oxide as well, which is the laughing gas, to keep you happy and relaxed throughout the procedure.
Are you a happy drunk?
I'm a happy drunk.
Okay, good. I want to see that.
Some nitrous oxide.
Have you used Pronox before?
Yes,
Do you know
I
how
have.
to use it? So you know, airtight, seal around your mouth, and only breathe in through your mouth, in and out.
I personally was nervous going into the procedure. If you watched my CO2 laser that I had done about a year ago, you know that I'm a baby and I'm afraid of pain.
Oh
my God.
Everybody
Feels like I can't. It's my blog. It was very painful. So going into this procedure, I was very nervous. But with the topical anesthesia, the nerve blocks, and the nitrous oxide, I was happy and content throughout the procedure. The procedure takes about 20 to 30 minutes, and we do multiple passes to ensure that the entire skin is being treated. Doesn't hurt as much. Don't wear makeup on the day of the procedure.
They told you yesterday.
I know, but I have to be pretty in the morning. Ow! This is the after picture. It looks a little traumatic. As you can see, I'm getting a bruise here, and I think I have another bruise here. This is not from the lidocaine, but rather from the procedure itself. We do have needles going in at 3 millimeters, quite a few needles going in. Whenever you hit a vessel, a bruise is possible. Otherwise, you see the pinpoint bleeding, which will scab over and fall off, again, from all the needles going in. The Pronox is wearing off. My high is wearing off. I don't feel drunk anymore. My lips are still numb from the blocks that I got inside the mouth. That will last probably for about an hour or two. But otherwise, I'm fine. I'm walking around. I'm feeling great. Whatever level of anesthesia you need, don't be afraid to ask for it. You need to be comfortable and you don't need to be in pain. As you can see, after the procedure, there is some redness and a couple of bumps, but nothing really to be worried about. No pain, no scratching, no itching. You sleep very well, and the next day you're almost back to normal. There's basically no downtime. Well, good morning, beautifuls. Today is day number 1 after Morpheus 8 that I had done yesterday on my face and neck. As you can see, there's a little bit of redness, a little bit of swelling, a little bit worse on the neck than the face. And I do have a bruise here above the eye. As I mentioned yesterday, the Morpheus is a microneedling radio frequency device, which has 24 needles that come out and penetrate the skin multiple times as we go with multiple passes over one area. So if one of those needles hits a vessel, you can get a bruise just like this here. But it should be temporary. There's no pain or any other problems with that. Otherwise, last night I just washed my face with soap and water and I put a gentle moisturizer on. Same thing this morning, and of course my sunscreen is always on, and I will stay away from the sun for the next couple of days. Good morning. This is day number 2 after my Morpheus procedure on the face, and as you can see, the skin is clearing. There's much less redness and swelling, a little bit of swelling remaining around the eyes, but otherwise the skin is clearing up. I do have a large bruise here above my right eyebrow, which after speaking with the doctor yesterday, it turns out that it was from the supraorbital block that I received for anesthesia, which is given here to numb the forehead, rather from the Morpheus needles. So it was not from the Morpheus needles. So for anesthesia, I got nerve blocks, both here in the chin, under the eye, and above the eye. So I'll keep you updated. Well, this is day number 5 after my procedure, and I'm here to tell you that my skin is completely healed. I've had a great weekend where I felt that the skin was luminous, and I actually felt that I could go without foundation with just some powder on the face. The skin is completely healed. There's no more blood pricks or big bruises or any kind of red marks, which I had on the neck up until about yesterday. As you see, I still have my bruise here from the supraorbital block, which I have very mixed feelings about at this point. Yes, it provided a good amount of anesthesia for the forehead, but I'm still tender here and I hate this bruise. So in retrospect, I may not get that next time. But yes, the skin is healed, it's luminous, I love it. I felt the improvement right away. So I can't wait to have my next procedure done. I'm very excited about it. If you have frequent cold sores or any kind of outbreak on the lips, whether from any procedures or from an illness, you should talk to your physician so that you can take antiviral medications to prevent an outbreak as you are getting a procedure such as this. I was lucky not to get one, but it can happen. So if you get cold sores a couple of times a year, please talk to your physician to take some antiviral medications. And in closing, I want to say that if you are like me and if your pain tolerance is relatively low, you do need to find a physician that can have different layers of anesthesia. For example, in my practice, I have topical medications, then I have injectable medications, whether mesotherapy or nerve blocks. And then we have the Pronox, which is the laughing gas that you inhale. It helps both with anesthesia and with anxiety. So the bottom line is this: whatever it takes to make you comfortable and relaxed, you should find a physician that has the techniques and the equipment to meet your need. There's no reason to be in pain to obtain your absolute best results. Here are some of the questions that come up often with my patients. They ask, how is this better than Ulthera? Well, with Ulthera, many patients report loss of fat in the face, which is not desirable at all. So with Morpheus 8, we don't have that problem. Additionally, Ulthera can be quite painful, which is not the case with Morpheus 8. Another question is, are the results guaranteed? And this is where the expertise of the practitioner comes into play, because the practitioner decides how deep the needles will penetrate and what kind of energy you should receive. And the most important question, how does this compare with a CO2 fractional ablative laser? Well, first of all, with Morpheus 8, there's no burning of the epidermis, there's no shedding of your skin, because all of the energy is delivered deep into the tissues that need to be targeted while sparing the epidermis. It's much better tolerated and not painful like the CO2 laser. And thirdly, Morpheus 8 is colorblind. So whether you're African American, Indian, or of Asian descent, this treatment is safe for you, which is not the case with the CO2 laser. As we know, the holy grail of skin rejuvenation is combination therapies, where we combine the toxins such as Botox, Dysport, with fillers, hyaluronic acid, and Sculptra, which is one of my favorites. And energy devices such as Morpheus 8 are safe to be used in combination with fillers and toxins, and they will not melt or disturb the product. Morpheus 8 is best to be used for skin resurfacing to increase the luminosity and the light reflection of the face. It also helps with the creases of the skin, any fine lines or wrinkles. It improves any complexion concerns such as brown spots and red spots. It helps with acne scars. If used on the body, it can help with cellulite and stretch marks. And when done effectively, it gives you that shrink wrap effect for that non-surgical facelift and rejuvenation. We recommend a series of 3 treatments which are done 1 month apart, but you will see results after the first treatment. After the first couple of days, you will see a luminosity and a clearing of your skin, but the best results really start occurring a couple of weeks after your treatment. If you have any more questions about the procedure, or if you want to book your appointment, please give us a call or check us out on our website. All of the resources are linked down below, and please subscribe and give us a good review. I hope to see you in my office, but until then, I'll see you in my next video.
Perfect. That's